And it's already generated a flurry of debate, but it seems a proposal to introduce a new fee for GP visits may not deliver the budget boost the government has been hoping for. A new report just commissioned by the Consumers Health Forum says low-income people will be the hardest hit. Health policy expert Jennifer Doggett wrote the report and joins us now from our Canberra studio. Jennifer, good morning.
Good morning, Michael. How are you?
I'm very well, thanks. Now, why, in your view, won't a co-payment work?
What we've found in the research commissioned by the Consumers Health Forum is that there are many Australians out there who are already struggling to afford their healthcare costs. By placing a co-payment and increasing the cost of receiving some of the most basic forms of healthcare, such as going to see a GP, it means that people will be unable to seek care at the early stages of an illness. That means their illnesses will get worse, which will result in more expensive healthcare, such as hospital treatment down the track. And this is not a sensible way to manage our health budget.
Which is potentially bad news for, as I mentioned, people on low incomes and people, because of various medical conditions, having to go to a GP potentially weekly, if not more frequently.
I think people on low incomes, older people and certainly people with a chronic illness would be hardest hit by this. The problem with healthcare costs is they're not spread unevenly across the population. We do have a group of people who are already struggling with the out-of-pocket costs of receiving care, and any increase in co-payments is just going to hit them hardest.
What do you say to people looking at the proposal put forward by the government and see $6 as a co-payment and argue, well, that's nothing? I mean, why shouldn't people pay that?
I can understand why for a politician $6 doesn't seem like a lot of money, but the reality is there are a lot of people in the community that a $6 upfront cost is actually very difficult to afford. And it's also important to understand that healthcare costs do not stop at the GP. Typically when someone goes to a GP, they also receive a prescription. They have to go to the pharmacy and fill that prescription. There are often further tests, x-rays, pathology tests, maybe a specialist visit or an allied health visit. These also come with co-payments. So the $6 is just on top of the co-payments that Australians are already paying. And we pay some of the highest co-payments in the world for our healthcare.
And just on that point, Jennifer, your report has a couple of disturbing case studies, including the case of Leonie Haven, a cancer patient who has spent $50,000 out of her own pocket because of those burgeoning health costs, and there are many more examples like hers.
I think that's true. The consultations that have been done by the Consumers Health Forum have revealed that there are a number of families in our community who are really struggling to afford even basic health care. And I think part of the problem is that governments haven't taken responsibility for co-payments the same way they have overseen the costs of private health insurance. So every year health funds have to go to the minister to request any increase in their premiums. The minister personally takes responsibility for authorising those increases, but there's no oversight of co-payments associated with health services. So that means that there's nowhere for consumers to go. If they're faced with these huge out-of-pocket costs like Leonie, there's no ombudsman, there's no ministerial oversight or responsibility for it.
OK, if not a co-payment, how does your organisation suggest those burgeoning health costs are reined in future years and future decades?
In the report for the Consumers Health Forum, I've suggested a number of different options for looking at how we manage our healthcare costs. I do think that's an important debate, and I do support Minister Dutton's intention to put that on the table and to open up the issue for debate. But I think what's very important is that we involve consumers and the community in this debate, and it shouldn't be just about short-term budget requirements. So I think the key to managing healthcare costs, and if you look internationally, look at countries that do manage to manage their healthcare costs sensibly, the key is having a very well-resourced and effective, cost-effective primary healthcare sector. So one which uses GPs, but also nurses, nurse practitioners and allied health workers who work together in teams to provide very high quality, good preventative care and to make sure everyone in the community has access to that care.
And there's a lot more debate to come, undoubtedly. Jennifer Doggett, great talking to you. Thank you.
Thanks, Michael.